Yeah, so I've been fired before, but he and I are best friends now. He and I, he's still there, he's staying there for so long, so we're still in good terms. Yeah, but sometimes you need to stand your grounds and speak up. I think what happened? Okay, quick one before we check in for work. It's a cold day, it's the jacket season. I'm wearing my t-shirt for work. It's the Corona t-shirt we made for work, so here it is. This is how it looks. So I just decided to document this journey. It's 10 years a nurse. I've been a registered nurse for 10 years now. I think I graduated from University of Ghana in May 2011. So it's a little bit over 10 years. May, June, July, August, September, October. So a little bit over 10 years, but it's not too late. I think this video might be helpful to a lot of people. So we're talking about 10 years a nurse, the journey so far, regrets, lesson, advice for somebody who wants to go into nursing and still skeptical. So relax and enjoy. The sun is out, it's directly in my face. I don't know if it's bothering you and bothering me. I have my shades on, but pardon me. And also the background noise as cars are moving around me. I'm sitting in the parking lot. So 10 years. I remember my dad was the advocate of me doing nursing. He was like, oh, you do nursing, you care for people, you're a nice person, you're gonna be great. So he applied for nursing for me. We filled the forms and sent it to University of Ghana, and I got admission. So how it works is that after secondary school in Ghana, which is high school, you go to college, which is the university. So from Ola Secondary School, I went to University of Ghana, where I did nursing for 4 years. So that's a bachelor's or degree, 4-year degree nursing program. So that's how I got my nursing degree from University of Ghana, West Africa. Okay, so that's where the accent comes from. And I had to come to the US and retake the boards. I'm sure those of you who have been following for some time know the story about how I had to take the boards and all that to get the NCLEX and start working here again. Yes. So right after completing uni, you'd have to do 1 year of national service, or what we call rotation, where you go to every unit in the medical system or in the hospital. You go to psych, you go to obstetrics and gynecology, you go to medical units, surgical units, pediatric units, public health. You do all that in 12 months duration, where you are called a national service personnel or a rotation nurse, and you get some stipend for doing that, something very little. I don't know how much it is now, but I think we used to be paid just 200 cedis. 200 cedis now, let's say $50 a month for doing that. The sun is out, so I know you want to see my eyes, so let me get this off for you. Oh, my eyes are tired. Yeah, early morning. I'm not a morning person, so I struggle to wake up. So you do the national service for a year. After that, if you happen to go to college, university, you'd have to apply for a job and search for a job. But when you happen to go to a nursing training college, you are posted to hospitals to work. But I had to apply for a job. It took 8 months for me to find a job after school to work. Yes, I was home for 8 months, very desperate, very frustrated, looking for a job, applying to private clinics, government hospitals, and all that. So finally, one came through. And it's been a challenge. First of all, when you go to the university and you come out as a young nurse, let's say those already working in the unit feel threatened, and those who don't have the bachelor's or the degree feel threatened that you're a young girl or a young boy out of school, and you could just come in to be on top of them in terms of rank and positioning. And they've been doing this for 10-15 years, and you just finished school 4 years and you're coming to be their boss. or higher up the rank. So that notion is already there before you step in. So you already become like annoying before coming onto the job. So some people are not very receptive to that. They tend to, let me put this back on. I think it looks good on me. I'm so exhausted. Some people are not receptive to that, so they tend to target you or be mean to you, or not to teach you stuff so that you can learn more and be a good nurse. Because we are tagged at book long, as in all we know is theory. We're not good at practical because we spent all the years in classroom, whereby those who went to nurses training college for 2 or 3 years are very hands-on because they go to the hospital and practice and do all that. So we are just book nurses. All we know is how to come, sit down, and write report notes and whatever on the patients, whilst the nurses are in the unit working hands-on. Those are all notions and myths. I've met degree and bachelor nurses who are very, very good, both theoretically and practically. But that's the notion, as I said. So you walk in there, not everybody's receptive to you. I've had people that are very unreceptive. You can't approach them to ask them for anything because they think you're coming to kind of steal or pull their knowledge, which is weird and absurd. But I faced that, and I met very, very nice people, and we're still friends till date. Some were very receptive, take you along, show you how to do this, how to do this. And I'm a very fast person. I'm a quick learner, so with time I picked up all I needed to pick up, and I gave all my best. I work hard. Not to blow my own trumpet, but if you know me, I'm a very dedicated person. I work hard, I put in all I can. So I'm a good team player. So if you're out there watching this and you have an offer for me, write that down. Kick, I'm a good team player. I did that for, I think 5 years, right? I did that for 5 years. Within that 5 years, I had moved about 3 different units. I was in a female medical unit. Then I had to go ahead a medical outpatient department within the same facility. So I went to do that. I headed that department, medical outpatient department, for maybe close to a year, I can't remember. Then I was sent back to the unit where I went to a male unit. The only difference, I made a video about the difference between nursing in Ghana and nursing in the USA. Nursing in the USA, all the patients are mixed, no matter your gender, male, female, they are all mixed on the same unit. So you go to a unit, room A might be a male room, room B might be a male room, room C might be a male room. Female, males all mixed on a unit. Whereby most hospitals in Ghana, this floor is the female medical ward, this floor is the male medical ward. Yeah, that was one difference I forgot to bring up. I'm sorry. So I work on the female medical. I went to head the medical outpatients, and I came back to a male medical unit. So whilst I was there, I did, I don't know, maybe 2 years. Then I was sent outpatient clinic, where it's a walk-in ambulatory sort of thing, where people walk in and check their blood pressure or check their blood sugar or do their wound dressing. They see the provider or doctor in the consulting room. They refill their medications for them, or we give vaccinations to people. We had a public health unit as well, and we vaccinate kids. Pretty much that was how it was. There was no inpatients, but along the line we opened up some units. We began admitting patients. I was working night shifts, and one thing was I was doing, I think, 1 week nights, 1 week off. So that has been my journey. But let me take you back to where I did my national service. So the national service, I did it for 12 months. As I said, it's a 1 year complete thing where you move from every unit. So we went to medical ward, surgical ward, psychiatry, HIV unit. Psychiatry was long. I think that was 2 months. We went to public health also for 2 months. So you get a bit of everything. I was a general nurse. When I was in University of Ghana Nursing School, there was no specialty whereby you might be in level 200 and branch and do pediatric or branch and do midwifery. No. So I was a general nurse from first level 100 to 400. We did general nursing, then we had a feel of other units during the national service place. But whilst in school clinicals, you know, you go for clinicals, 6 weeks clinicals, or once every week clinical that we used to go. So you go to different units, so you have an idea. You do ENT and all the stuff, you know what they look like. Then after, if you want to specialize after your bachelor's or degree, then you go and do whatever you want to. So that has been my journey. One thing I have learned, lessons, it gives you a bigger heart. It makes you more patient. You become a good listener. You learn to multitask. American will say multitasking. You learn to multitask or multitask because you are thinking about one patient, but you have 10 other 1,000 patients to think about. Your mind is on several things going on at the same time. You're here, oh, I have to do this wound dressing, I have to pass this meds, I have to call this family member, I have to discharge this person, oh, I forgot to put the instruments back, I have to bleach it and send it back. So you are all over the place. Yeah. And you become an advocate for the patients that cannot speak or their family members cannot speak on their behalf. You have to fight for them, talk to the doctors and providers and say, oh my God, this patient, it will be good if they will benefit from this treatment or they'll benefit from this medication. You become an advocate. And on the job, you are a telephonist, the phone is ringing, you are picking the call, you are giving people discharge instructions, you are a listener, you are the secretary, you are filling paperwork, you do so many things, so you become very active. Your mind is sharp because you have a lot of things being thrown at you at the same time, and you're just responding from all angles back and forth so that the day will go well. Those are some of the attributes I have built over the 10 years of my journey. Advice: if you want to go into nursing, I would advise you to go into it. It's a good field. You become very fulfilled caring for people. Sorry about that. You become very fulfilled caring for people, listening to people, watching somebody who was very, very sick get up and go home. It's very fulfilling. I can't describe it with words. Some do die. You become very emotional. Some have nobody to help them out, and you would go out all your way out to help people out. It makes you a better person. You're able to care for your family, you're able to care for your kids. You become a better listener. You just become a whole caring person. But if that's not your nature, nursing is not going to teach you that. I've seen horrible, mean patients who be mean to patients and mean to family members and all. Yes, so some of them are inherent attitudes and attributes that you have. Then when you get into the nursing, it polishes better and shines out and exhumes all that. So I'm using all those words, but I think you understand what I'm trying to say. Yeah. Regrets. Do I have any regrets? Sometimes you have a hectic day, horrible day, your whole body is hurting, your back, your feet, or you get injured, or a patient curses you out or abuses you, throws things at you. Then you're wondering, oh, you lose your self-worth. Like, I'm this person, and why am I going through this, or why am I allowing this to come at me, and why am I doing this? There are some days you feel very sad. You meet very, very mean patients that actually fire you. So one difference also is that a patient can fire you. I never heard that before. A patient could never fired me in Ghana, but here a patient can say, I don't want Priscilla as my nurse, and they have to listen to that patient and change me and give the patient a different nurse. Yeah, so I've been fired before, but he and I are best friends now. Here now, he's still there, he's staying there for so long, so we're still in good terms. Yeah, but sometimes you need to stand your grounds and speak up. I think what happened, he's over 300 pounds in terms of weight, and he asked me to pull him. Luckily, I had another person there with me, so I was like, oh, I'm sorry, I can't pull you, look at my size, I'm little, we'll topple over, and do you want to try? We can help you, but I can't pull you all by myself. Then he flared up and started cursing out and said, walk out of my room, I don't want you anymore, and all that stuff. Yes, so that's how I got fired. So it's nothing like I was mean or anything. I don't have that mean thing in me. It comes out when it needs to come out, but not on patients who are sick and need my help. No. So that was how I got fired. So the difference is that the patient can fire you and they'll change you and give you a new patient or assignment, and they won't give you that patient anymore. But they have to do a little bit of investigation and see what really went on it. But when he insists he doesn't want you, patients have a right, patient charter. So the patient say doesn't want you, there's nothing that can be done. They just have to switch you and give him a different nurse. I love being a nurse. I love doing what I went to school for, It's fulfilling. The advantages as well. Anywhere you go in the world, you still find some place to work, some type of hospital or outpatient or clinic, some type of place to help people out. So your job is assured. If you go in with a money mindset, you can be a little bit disappointed. It is not as rosy and as rich as people portray it to be. It depends on where you are, what your specialties are, what you've done so far, and the years you've acquired before you get that benefit. So if you go in, I'm going to hoard money and stuff, you go in and be disappointed. Everybody with their higher rate, their rank, and what they'll pay you, and every facility or hospital with what they pay you. So you see some nurses that struggle, work years, and have nothing to show for it. You can't blame them. They all have responsibilities. The money is not enough. They have other things they are doing. You see nurses that are being entrepreneurs. They have YouTube channels. They are selling scraps. They are selling medical supplies. They have different channels and hustles on the side to complement what they are earning. People have huge student loans. People have family responsibilities. People have projects going on in there. So sometimes it might be in a good place. The money might be okay. If you're not spending on anybody, you might manage it within your means, but it is not rich as they portray. You make the money, you pay huge bills, you lose it, but you still have some to save if you have that saving culture too. So people go in because the job is assured and they think they would make money from it. It might have worked for some, it's working for some, but it's not working for some. So have that at the back of your mind. If you're skeptical, should I go to nursing school, or should I go to medical school, or should I just forget the health? I think what you have to do is go to the hospital and take a tour, ask permission, and see what really a nurse does. Then you see whether this is meant for you. And if you're lucky to have been a patient, you might have experienced that. But one thing I like here, which is a shadowing, I see little kids from high school coming past to the hospital. They want to be medical laboratories, they want to be doctors, nurses, physiotherapists, any type of thing. So they come around and see if this is what they really want. So you start grooming yourself towards that. So one thing I also experienced that I liked is after you get hired, you have a preceptor that you stay with, you're attached to, you train for 3 months, 12 good weeks before you are left alone to be on your own. That is one difference too that I never experienced in Ghana. Right after the national service, you are thrown into the unit and you are floating and you are on your own and making all these mistakes and nobody's keeping an eye on you and correcting you. So that preceptorship idea is a good thing. I would have to speak to some people about if they can do something like that. The in-service trainers can handle that. I have one person in mind I can talk to if they can have a list of preceptors. Train those preceptors. It actually counts towards your credit hours or your CPD or your logbook something. You go for preceptorship training. So you are a preceptor. They teach you the things to look out for and the things to teach the students when they come, or the new hired when they come. So you are attached to that person. So by the end of the 3 months, you are good. You are confident. You know what you're about, and you go and you are a safe nurse. You know. So that preceptorship thing was one thing I didn't bring up as a difference. So this video is a measure of my journey so far, the things I've experienced, the likes and dislikes. And thanks for watching, thanks for subscribing. I hope I didn't go too fast. I hope this video made sense to you and you could relate. If you're a healthcare worker, if you're a nurse, if you want to share your experience under the comments, please subscribe. I've said this enough. Subscribe, click on the subscribe button. I'm doing a good work. It's not easy to be on this journey. I brought myself on this journey, but you had the reason why I'm still here. Thanks for supporting me. I need to go into work. I don't need to be late. So thank you very much.